Gait. Movements of the limb with respect to trunk resulting in forward propulsion of body is known as gait. During gait examination, the subject should always be barefooted. Types of pathological gait. Antalgic gait. Time taken on the affected leg is reduced. Body weight is shifted quickly to the normal leg. The pain is due to trauma, osteoarthritis, etc. Because of neurological dysfunction, spastic. First is circumdictory gait. It also covers paralytic gait. It is due to deformity in knee flexors, which are set of hamstring, gastrocnemius, sartorius, gracialis. Second, scissoring gait, seen in children with cerebral palsy with motor neuron impairment. There is also another form of scissoring gait in which there is adduction and internal rotation of hip and flexion of knee and ankles are inverted and excessive plantar flexion which drags the foot against the ground. Third, paralytic gait, circumduction of leg. Circumdictory gait include both hemiplegia and diplegia. Flexion of hip, adduction, extension, and internal rotation of knee occurs and ipsilateral side hand undergoes adduction of shoulder, flexion at elbow, wrist at pronation, thumb and fingers are tucked inside in fist position. Flaccid. First, Treadlenburg gait. Lurching gait. It is due to unilateral weak hip abductors which are gluteus medius and minimus. Weak abductor of left pelvis droop on right side and vice versa. It is also seen in fracture of neck of femur, dislocation of hip, gluteus medius paralysis, congenital coxa vara. Second, waddling gait, bilateral lurching, also called myopathic gait. It is due to bilateral weak hip abductor. Person will walk like a duck. It is seen in muscular dystrophy and other muscle diseases. Third, quadriceps gait. It is seen in poliomyelitis patients. It is due to weak quadriceps femoris muscle. Its action is to extend the knee, but since it is weak to extend the knee, the person need to apply an external force to buckle in the knee. So the person uses his or her ipsilateral hand to apply the force on the knee joint to extend it. If person doesn't apply the force, the person will fall. Fourth, gluteus maximus gait. Forward movement of body is due to hip flexion, which is counteracted by hip extension. But hip extensor, that is gluteus maximus, is weak. So in order to move forward upper body, instead of flexion movement, it does extension so that hip extensor won't have to do much work. Fifth, foot drop. There is exaggerated flexion of hip and slapping of foot on the ground. It is due to weak dorsiflexors of foot which are tibialis anterior, extensor hallucis longus, extensor digitorium longus. It may be also due to injury to peroneal nerve which may be due to L4, L5, disc herniation, knee injury, dislocation, hip dislocation. Other includes first, ataxic gait, drunken gait, found in cerebellar dysfunction. Person have wide based torso. Person will not be able to walk if they asked to walk to tandem. They will not be stable in neutral position. Second, shuffling or fascinating gait, seen in Parkinsonism. It is seen in basal ganglia dysfunction. Person will take slow, small, and shuffling type of steps. Initially, it will take a great willpower to take a step, but when they gain momentum, they take fast steps. Face will be expressionless and person will bend forward. Third, choreoform gait. Dancing movement. Involuntary movement of muscles due to overactivity of neurotransmitter dopamine. It is primary feature of Huntington's disease and one of group of a neurological disorder called dyskinesia. Fourth, paraplectic gait. In this person will shift the center of gravity forward and both legs are apart from each other at fixed distance due to abnormal deformity. First, equinus gait. Person walk on toe, no heel strike, seen in plantar fasciitis patients or due to congenital deformity. Second, knock knee. Knee joint internal rotation and ankle remain spaced apart. Third, bow knee gait. Both knee joint are apart from each other.